Hello, friends, family, and coworkers. If any of you have crossover status there, um, I am going to do a little lower back clinic right now because I know a lot of you are often telling me that you're struggling with lower back pain. And as many of you know, I was a gymnast from the time I was 5 to 15. And in that time, I had multiple injuries on my spine, I also walked around with a hyperextended lower back. I threw my back out for the first time when I was 18, and then basically every year would throw it out in one way or another until I was about 40. And then I finally found a way to heal my back. So I'm going to share that with you because it feels like such a hopeless problem when you're suffering with it, and it's actually very, very manageable. So um, I'm going to give you some things to do, but I want you to be aware that if you're in a state of acuteness, like you're experiencing um, nerve pain and muscle pain that's so just uncomfortable because of the nerve pain, then you only do what you can do and you don't do what doesn't feel right. So it may be that on certain days all you can do is lay flat, or lay with your knees bent, or lay with your knees up on stacked on pillows with your legs over a stack of pillows, and that's all you can do that day. And take your Advil and drink a lot of water. And then maybe the next day you'll be able to tip your hips about a little bit, get some mobility inside your hip joint, and maybe that's all you can do that day. Maybe one day you'll be able to stick a tennis ball underneath your glute and release some of the spasming that's happened in that area. And it may take a while. Like, when I would throw my back out, I would still feel it for probably 4 weeks before I would actually feel that there was no more injury in that place where I had thrown my back out. So it's really important that you listen to your body, but it's also important that once you've gotten to the point where you've healed, it's really important that you do these exercises, a couple times a week, and that because what happens when you throw your back out, generally speaking, for most people, you may have a disc that's bulging into your spinal column because your spine has compressed, and that's causing that disc to bulge into your spinal column, which then touches nerves and is so painful. So in order to try to improve that situation, what we want to do is elongate the spine and then strengthen the core to hold the elongated spine, and then just maintain that. And I'm telling you, it's actually a very small commitment to maintain core strength and keep your spine elongated. The other thing that frequently causes lower back pain is where the joint, the hip joint, meets the sacral joint on the back, at the bottom of your spine. If you can imagine, this is the hip joint, this is the sacrum meeting together, it's just not a great connection, and it's easily pulled off kilter. And what pulls it off kilter is when, say, down here, your hamstrings are too tight or your glutes are too tight. It's maybe going to pull that sacral joint down a little bit and get this off kilter and start activating all the nerves in that area, which then activates all the muscles, and then they all start spasming, and then other muscles get involved, and you just end up with a whole circus going on back there. You can also get this hip joint getting pulled up a little bit, and that can happen because your psoas muscle, which connects your pelvis to the back of your spine, if that gets tight, it can cause your hip to pull up on one side or the other, creating that little dislocation in the SI joint. So let's start with some of the things that you can do if you are in a state of acute pain and you want to start just moving yourself towards a place where your back can heal. I should mention really quickly here that in addition to hamstrings and hips, the tightness of hamstrings and hips playing a big part in, when I say hips, I mean your glute muscles playing a big part in lower back discomfort, lower back injury, lower back pain. The other thing is not having good mobility inside the hip joint. So here's your hip joint, say, and here's your femur, this bone right here, and it fits, right up inside there, and it needs to be able to do all the things it needs to do when you are, walking, running, sitting, standing up, all those things. You need to have mobility inside that hip, and there's so many muscles all coming together in that area that it requires you to focus on, all the muscles in that area to keep that mobility in your hips. So when you're in a state of acute pain, first you have to decide whether or not you can move at all. Maybe you can't. Maybe you need to lie on your back and put a stack of pillows up, put your feet, your legs up over those pillows, and just rest and relax and drink a lot of water. When muscles get dried out, when they're not hydrated enough, I don't know if you've ever seen like what a chicken looks like if you leave a chicken breast out for too long and the top of it dries off, and it's just it's just dry, and there's no moisture to it, and those muscles are supposed to move freely past one another, but if they get dehydrated, then they don't. They kind of cling on to each other, and nerves that are traveling through get bound up in there too, and that's why hydration is important. So if you're to the point where you actually can now do something to improve your lower back pain, or you're in the maintenance part and you want to keep your lower back feeling healthy, then you want to just do a really simple tilting of the hips, which starts to create a little bit of mobility in the lower back. And you may find that tilting up towards the sky feels fine, but going into an arch doesn't feel fine. So that's good information. Then do what feels good, tilt up towards the sky, and don't put as much of an arch in your back. Don't do anything that actually hurts. So if you're experiencing lower back pain at the moment, you don't want to roll down like this in all likelihood. You probably want to turn onto your side, lay down on your side, and roll onto your back. So you're going to plant your feet about hip distance apart, and they're up pretty close to your buttocks. So not out here, but pretty close to your buttocks. And then on an inhale, you're going to point your pubic bone up towards the sky. And on an exhale, you're going to roll your pubic bone down towards the mat, which creates a little arch in the back here. And again, inhale, point your pubic bone up towards the sky, really flatten that belly. And then point your pubic bone down towards the mat, creating that little arch in the back. And your movements can be extremely subtle and still be useful, or they can be a little bit less subtle. What you want to do is go with the range of motion that feels therapeutic to you. So no pain and no strain, just stretch. So that right there may be all that you can do that day. But this is one of the poses, yoga pose, that you can do that will increase mobility in your hips. The next level of mobility creation is to do a thread the needle. So you cross your right leg over your left. You take your right hand and you push that left knee away, your right knee away from you, and then you do that pelvic tilt again. So on an inhale, you're pointing your pubic bone up towards the sky, and on an exhale, you're pointing your pubic bone down towards the mat. And you just do a little bit of this, let your breath set the pace for you. Exhale, pubic bone points down, back arches. Inhale, back flattens against the mat, pubic bone presses up towards the sky. And then to take it now to the next level of creating mobility inside that hip, it's actually this hip over here, you're going to do what's called thread the needle. So your right hand comes through your legs and your left hand comes around and clasps the right fingers. Grab a hold of the back of that left thigh, let the front of your left leg relax. If you're able to, not everybody is, crook your elbow over there against your right thigh and gently press that leg away from you as you draw your left leg towards you. Now, this is an excellent stretch and almost everybody feels it. And sometimes all you're going to be able to do is just slightly draw that leg towards you. That's fine. You know, if you can't push that other leg away, your right leg away with your right elbow, that's fine. The key is to just go to where you feel stretched and not strained. And you're going to breathe, 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 because breathing makes oxygen circulate through your body in your bloodstream. And then you're going to shift your weight a little bit over towards the right. It's a little bit of a balancing act, but you find the place where you can comfortably balance. Take an inhale, and on your exhale, you draw that left leg towards you again and push that right leg away with your elbow. And you're going to find a different stretch here. It's going to be in a slightly different place. And you're going to find that maybe there's a little bit more opening on this side, or maybe not. And that's fine. Continue to breathe in this place. And remember, if you're feeling a stretch in one part of your body, don't get the rest of your body in on the act. In other words, be mindful about keeping your shoulders relaxed and your belly relaxed and your jaw and your tongue relaxed. And then you're going to move on through over to your right side. Find your place of balance over here and find your stretch. On this side, what happens when you take an inhale and then on the exhale, pull that left leg towards you, push that right knee away from you with your right elbow. Where's the stretch on this side? Continue to breathe. Continue to disengage other parts of the body that don't need to be engaged right now. Be mindful of your throat, your tongue, your jaw, your neck, your shoulders, your chest, your belly. They should be soft and relaxed. And then roll on back to your center spot. Drop your left leg to the ground and just hold for a minute. There's actually been quite a lot of movement going on in that joint, so we just want to let it settle for a second. Uncross our right leg, settle again. And now we do the same thing on the left side. So we cross the left leg over the right, the ankle is at the knee. And on the inhale, you point your pubic bone up towards the sky. And on the exhale, you roll into an arch, pointing your pubic bone down towards the mat. Inhale, pubic bone goes up towards the sky as the small of your back goes flat against the mat. And then the pubic bone points down towards the mat and you get that little arch in your lower back. Again, this can be a very, very subtle movement. If all you can do, because you're in a time where you're experiencing a lot of strain or discomfort or pain, if all you can do is just little teeny micro movements, that's going to help you. And you don't want to push past that if it causes you any pain. If you're in a place where you can go to the more elevated stretch, you're going to thread the needle. You're going to take the left hand through the legs, take the right hand around back, grab a hold of the back of that thigh, interlacing those fingers, flex that left leg. I didn't say that on the right side, but it's good to flex the left foot because it keeps the knee in a more secure place. And now you're going to place your left elbow close to the left knee, if you can reach. Not everybody can, because your legs may be too far away from you to make your elbow reach your knee. You're going to take an inhale, and on the exhale, you're going to draw your right leg towards you, and if you can, gently push your left knee away from you with your left elbow. Breathe in this very intense, what can be an intense stretch in a very dense group of muscles. And remember, soften where you can soften. So if you can soften your pelvis while you're doing this, soften it. If you can soften your belly and your chest and your shoulders, then do that. And there's always the ability to soften the throat, the tongue, the jaw, the face. Go ahead and shift your weight over to the right side and find the new stretch over here. You can go ahead and pull that right leg towards you, push the left away from you, and the stretch is going to be in a slightly different place. Continue to breathe. Roll on through that neutral spot over to the left hip, and now find the stretch on this side. Remember, your left foot continues to stay flexed, and your right one is just slack. On the inhale, you prepare for the stretch. On the exhale, you execute the stretch. Gently, respectfully drawing that right leg towards you, gently pushing that left knee away from you with your left elbow. Roll on back to center. Drop the right foot, hold the left foot where it is, just for a moment. Let your lower back settle. And then unwind. And again, let yourself settle. So, you stay down. I just want to show you something. And that is that there's something called the psoas muscle that comes here at the front of the pelvis and goes back and attaches to the top of the spine, where the spine, not the top of the spine, but the middle of the spine, where the spine meets the rib cage. This guy invented this thing where you can actually do something called a psoas release. I don't remember his name. You can Google it. But the psoas release, it's hard to find your psoas muscle. It's underneath all this stuff that's going on in the middle of your gut here. But once you know when you found it, you'll know your psoas muscle. So it's very much worth practicing finding that thing. You start by putting your finger in your belly button and then going over to the right an inch and then up an inch. And now press in and start pressing around until you find something that feels kind of tight and kind of scratchy. Kind of feels like there's maybe something scratching it. The scratchiness is the spasming of the muscle. That's the binding up of fibers that shouldn't be bound together in muscle and in nerve. And you just want to so you're doing this on your back. You just want to kind of press around that whole area. Don't worry about poking any organs because they don't mind being poked. They're fine with being gently agitated. And just keep on pressing on that area, working your fingers around in a circle, a little bit up under the rib cage and then down. You'll know it after a while. And then do it on the other side. So you take your finger, put it in your belly button, go 1 inch to the left and 1 inch up, and now start poking around in there until you find something that's long and tight, dense, and maybe a little bit scratchy. And then just like I apply quite a bit of pressure with both my fingers when I do this, because the psoas release, once you find the psoas muscle, oh, it's the happiest place in the world to release. You feel so good afterwards. I do anyway. Okay, so now that you have worked on both sides of your psoas muscle, just relax for a moment and enjoy the blood flow in the gut. It probably has created blood flow all over the body. Maybe also you can feel it like around your brain. And you just might feel slightly more soft, relaxed, and open. A psoas release, I'm sitting up, you stay where you are. A psoas release is one of those things which can give you immediate relief if you're feeling a great deal of lower back pain. So it's quite a therapeutic thing to do, and generally shouldn't distress any of the muscles that are too far engaged in the problem. You will have that scratchiness, you might feel some discomfort, but it's not going to be like, for example, if you were to start working on your glutes or something like that, which could send you like right through the roof. But speaking of your glutes, if it doesn't send you through the roof, take a tennis ball. You're still lying down. I'm going to lie down now too. Remember, if your back is bothering you, you turn your knees to the side, you get yourself down on your side gently, and then you roll onto your back, okay? So take your tennis ball and place it underneath one of your glutes. I'm picking my right glute right now. And you want to be very conscientious about not having the tennis ball be on any bone. So no hip bone, no spine, no tailbone. Find a nice dense muscle and then just start rolling around a little bit, changing the position of your body and just getting familiar with what your glute muscles are like. You've got a maximus and a minimus and probably some other stuff too. I've got a bug. Okay. And now once you've gotten yourself familiar with the muscle, which by the way, goes up and connects to the hip, then you're going to take in the case of, I've got the ball under my right glute, so I'm going to take my right leg, cross it over my left leg, and now I'm going to turn my weight towards the right and really kind of lean into that ball. So there's a couple of things that you can do. First of all, if you find a very sensitive spot, that's good. If it's too sensitive to work directly on it, work right around the perimeter of it. But doing this is going to provide immediate relief to your lower back. So what you want to do is find those sensitive spots, and then you can just press the ball right into that spot. Or you can go around in little circles if that feels better. Or you can shear the muscle by going back and forth, back and forth, back and forth. Any one of those three things is going to provide you good therapy. This is the kind of thing where there's so many dense muscles in the buttocks that you could do this for 10 or 15 minutes on one side and continue to provide yourself therapeutic relief. But blessedly, you could do it for 2 minutes and give yourself some therapeutic relief as well. Awesome. So when you've had enough of that, go ahead and lift your hips up, put them back down, take that tennis ball out from underneath your right glute, uncross your leg, take a moment to let yourself settle, and now cross the left leg. No, not yet, sorry. So now take your ball and put it underneath your left glute, and go ahead and start exploring the muscle that's back there. It goes all the way down, and it goes over to the side, and it goes all the way up. But you want to make sure that you follow the cardinal rule of not touching, the ball should not be pressing on bone. So no spine, no hip bone. But find a nice dense muscle where you really feel the therapy when you press that ball on there. Cross your leg, left leg over right, ankle at the knee, and then turn and lean in to where the ball is pressing on the muscle. Here's where you might feel, well, I don't know, sometimes it feels to me like someone's trying to cut my muscle with a razor blade. But as awful as that sounds, it's actually therapy. And so I've come to seek and enjoy that particular kind of pain, for lack of a better word, because I know that it's going to give me some immediate relief and it's going to be good therapy. So find the spots that you want to give therapy to, and then do so. And then you can use how much pressure you put in your right foot in this case determines how much weight you're pressing down on that ball. Ooh-wee. When you've had enough of that, take that tennis ball out, replace your hips on the mat, take a moment to settle, and uncross the legs. Okay, let's see. So those two things, you stay down. I'm getting up just for a moment. Those two things, the glute, the tennis ball under the glute, and the psoas release can provide immediate relief. And it's not uncommon that you backslide a little bit during the day and do it again and get relief again. So, but it's ultimately going to also get you where you need to go, which is to have strength and mobility and flexibility in the glutes, in the hamstrings, and in the hips. Okay, so we're back down on the ground, and this is another one that you're going to want to do on a fairly regular basis, and you're going to want to try to do if you're in an acute state, but you're not going to press through if you're not ready to do it. If you're going to aspire to do it, and you'll be really happy the day that you finally get to do it, and then you'll do it as a maintenance. So I'm rolling back this way. You remember to go down on your side when you are getting down onto the ground. So we're going to do bridge pose. The best way to do bridge pose, because a lot of people when they do bridge pose, they let their legs flail out. It's very common, especially in people like me who have very tight muscles here and very open and flexible muscles on the inside. So we'll flare out because the muscle is actually getting constricted and it's really hard to keep alignment. So what I do is I take a block and I put it between my knees and I plant my feet comfortably close to my buttocks. I take an inhale, and as I do, I point my pelvis up towards the sky like I was doing before. Let's back up for 1 second. Before we do that, I want you to take a few moments to squeeze and release your block, okay? So take an inhale. On the exhale, squeeze your block between your knees. Squeeze, 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 squeeze. That's going to wake up all those leg muscles, internal and external. And then relax. Take an inhale. Exhale, squeeze, 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 squeeze. And at the end of the exhale, relax. Third time, take an inhale. And on the exhale, squeeze that block between your knees. Squeeze, engaging all of those muscles in the legs. And now when you're ready, exhale. At the tail end of your exhale, relax. Okay, so now we're ready to do our bridge pose, having woken up some of those muscles and brought some blood flow to that area. So you're going to take an inhale and point your pubic bone up towards the sky. And then on an exhale, so your back's still flat, very flat against the ground. All you've done is take the lower part of your buttocks off the ground by pointing your pubic bone up. And now you're going to relax it down. Don't bother going into an arch, not necessary here. Inhale, and this time you're going to lift just the first few vertebrae up off the ground. So the mid-back is still flat on the mat, and the pubic bone is pointing up towards the sky. And now going down one vertebra at a time, and there may only be like 4 there maybe, but nice 1, 2, 3, 4. Roll down one at a time as you exhale back to your relaxed and neutral position. Take an inhale, point your pubic bone up towards the sky. This time you're going to come up off your mid-back so that the back of your rib cage is flat on the ground, but your mid-back is up and your lower back is up. And you're pointing your pubic bone up at the sky. And again on your exhale, you do the same thing, one vertebra at a time. Down, 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 down. Not sure if I'm counting the right number of vertebrae, but good enough. Inhale, point that pubic bone up at the sky, lift it towards the sky until you come all the way up off the back of your rib cage, and you're on the backs of your shoulders. So now the buttocks, the low back, the mid back, and the rib cage are up off the ground. Your arms are down comfortably by your side. In fact, if you push into the backs of your arms, you'll give yourself a little bit more support and structure. Now squeeze that block again. Squeeze it, squeeze it, squeeze it, squeeze it.
Now on an inhale, bring those arms up and overhead. And on an exhale, we're going to go down one vertebra at a time. So we actually have to pull our hips forward a little bit and make the space to come down one vertebra at a time. And while we're here, we're going to take an inhale here with our fingers up over our head. And we're going to lift up our head and our shoulders and keep our arms right next to our ears. That's an inhale. Exhale, draw those arms down by your side. So what we're doing here is creating a nice little bit of core strength. Inhale, the arms are going to stay next to your ears and your head's going to stay up and your shoulders are going to stay up. And then on the exhale, you're going to relax down. Let's do that again. Take an inhale here. Exhale, the head and the shoulders come up off the ground along with the arms staying right next to the ears. On the exhale, those arms come down by your side. On the inhale, the arms return to your ears, and you're going to hold it there just for a breath or two, a beat or two, not even a breath or two. And then on an exhale, the shoulders go down, the back of the head hits the ground, and the hands come down on the ground as well. Take an inhale here, and on the exhale, draw those arms back down by your side. And remove the block from between your legs, and then just take a moment. Like you've been moving your spine around a lot, let's just take a moment to let it soften and settle. Roll on over on your side and press yourself up into a seated position. So there's 3 more poses, and of course you can fast forward at any time and just go to the poses that you want to do. There's nothing magic about doing them in the order that I'm doing them, except that it's important to relax and soften after you do each one and not move through them too quickly, okay? So this one is pretty much something I can only do if I'm feeling my back is really healthy. And this really creates nice mobility in the hips. But it's pretty hard to do if you're in an acute state. So if you're coming out of, you're like in your 3rd week of healing from lower back pain, from having thrown your back out, this might be a time to ease into this. I don't know, for some of you it could be a week, 3 weeks, 4 weeks, but it's really worthwhile. It's wonky and it's a little bit awkward, but it's very effective, so I highly recommend it. You take your right leg and you place it in this awkward position. So your foot is behind you, your knee is in front of you, and your knee is as close to being in line with your hip as is comfortably possible. And then you take, in this case, the left leg, and you press the foot against this right leg and let the left knee open up. So some people have a really difficult time being flat on the ground, having both buttocks flat on the ground. Sometimes you're going to have one up a little higher than the other. So you don't want to have one higher than the other. You want to be parallel back there. So you can take, this is my foldable pillow. Got it from yogaoutlet.com. And you can tuck it there underneath your sits bones. And with that little bit of elevation, then your sits bones are flat to the ground. In this case, the pillow. So then you're going to do that pelvic tilting again. And what the goal here is to create more mobility inside this hip, okay? So you round the back on an inhale, and then on an exhale, you arch the back. So on an inhale, you round, and on an exhale, you arch. And you're just, it's a pretty subtle movement. Like, you don't have to do a big full opening of the chest, although that feels good. You can do it if you want to. But even if you just kept it like this, just super small, that's okay. You want to go with the mobility that your body is telling you you have at any given time. Now remember, your mobility can be completely different from day to day, or even from early day to late day. If you do a lot of sitting, you're going to affect the mobility. If you do a lot of driving, you're going to affect the mobility. If you do a lot of walking, you're going to positively affect the mobility. So your body is a different body every day, and you should, this is a total, maybe I should have said this 30 minutes ago, total no judgment zone. This isn't, gosh, I wish I'd done this earlier. Gosh, I can't believe I let it get this bad. Gosh, I'm never going to be better. First of all, you are going to be better. You're here now. We're doing it together. This is a no judgment. This is a time that it's really important, especially in our culture, that this is a time when you are incredibly kind to yourself. Be as kind to yourself as you would be to your most favorite friend. Okay? Okay, so I've been doing the tilting, and now I'm actually going to move my pillow because I don't need it. You take your right hand in this case, and you grab a hold of that femur. Now what you're going to do is actually, you're going to encourage the femur to turn inwardly, and it feels kind of weird because you're like, how much can I encourage my femur to turn inwardly with my hand? And the answer is enough, which is just a little bit, but it's enough. So you take an inhale, and as you do, you turn your rib cage and your shoulders so that you're looking at the back wall, gazing over your left shoulder, and at the same time, you're just encouraging your femur to rotate inside that hip bone. And then we rotate back through our neutral place and turn our rib cage and our shoulders so that we're looking over our right shoulder. And now we're just gently encouraging our femur to open outwardly. Inhale, encourage that femur to turn inwardly as you turn your ribs and your shoulders and gaze over your left shoulder. Exhale, rotate through neutral, turn the ribs and the shoulders and gaze over your right shoulder, encouraging that femur to just open up. Do that again on an inhale. And to the opposite side on an exhale. And then return to neutral. Give yourself just a minute, especially when you've been twisting your spine. Anything in the lower back or the spine. You just always want to give yourself just a moment to soften. And then turn yourself over and do it on the other side. So what you can see ideally, and again, this is an awkward pose. A lot of people don't have a lot of mobility in their hips, and so if you do this a lot, you're going to create nice mobility, but if you don't do it a lot, it's going to feel awkward, and that's okay. Be gentle with yourself, because you don't want awkward pain, but sometimes you just feel like awkward, like I don't move that way, and that's all right. So what the beauty of this is, like I said, when you're doing this, you're encouraging the femur. Let's see. Here's my femur. Here's my hip socket. You're encouraging actually the hip to move like this around the femur, right? And then when you're going the other way, you're encouraging the femur to turn like this inside the hip bone. So that's how we're getting mobility this way, and then we're getting, how did I do it? Yeah, we're getting mobility this way. Okay, so again, we round on an inhale and we arch on an exhale. You're going to be doing very good work for yourself, even if these are very subtle movements. And remember, by no means is this a competition. You're not in competition with who you were yesterday and who you want to be tomorrow. You're here right now, just paying attention to what your body needs in this moment. Now when you're ready, take that right hand and plant it next to your right leg. Take an inhale, turn that femur with your hand, and rotate the rib cage and the shoulders so that you're glancing over your right shoulder. And on the exhale, you move on through and turn your ribs and shoulders and glance over your left shoulder. Again, on an inhale, encourage that femur to turn along with you as you rotate your ribs and your shoulders and look over your right shoulder. And on the exhale, you're moving through your neutral until you can move your rib cage to twist to the left along with your shoulders and gaze over your left shoulder. Do it for a third time. Encourage that femur to go along with you. And as you exhale, you rotate through neutral, turn your shoulders and your rib cages towards the left, and you're encouraging your femur to open up. rotating outwardly. Okay. I've forgotten what I was going to do. Well, I just thought of one. So if you are experiencing lower back pain in this moment, then I don't want you to do this this exercise. This is maintenance only. I remembered. Okay, so we'll do the one I remembered, and then we'll do the one that you're supposed to do for maintenance only. So the one I'm about to do, cat-cow pose, is one of the ones that you can do very subtly if you're just trying to improve your mobility, improve your muscle discomfort until your back heals. And you can start off very small and make it bigger depending on how it feels. So, tabletop position. Knees are over hips. Hands are under shoulders. On an inhale, you're going to arch that lower back and you're going to draw your chest forward and lift your chin until you experience a nice stretch in the belly but no discomfort in the lower back. It may be that you have to stay pretty neutral because going into an arch, if you are experiencing lower back pain, can be very uncomfortable. So you can keep it neutral and just pull that chest forward and gently lift the chin, or you can go ahead and put that arch in the back if you want to get that belly stretch. And then for the cat portion of the stretch, you tuck your pelvis under and let your head drop. And now you push the ground away from you as you draw the back of your heart up towards the ceiling. And really let that neck relax so that your head is just like a big weight that gives traction to your neck. Inhale, turn to your gentle arch, draw that chest forward, gently lift the chin. And to go to the cat portion of the pose, tuck your pelvis under, let the head drop, push the ground away from you, and round that back so that the back of the heart is reaching up towards the sky, and draw your navel towards your spine as well. Really let that head relax. Relax those muscles in the neck. Let that head create traction for the neck. Hoping you can hear me okay because I'm talking into my shirt. Inhale, put an arch in the back, draw that chest forward and gently lift the chin to get a belly stretch. And for the cat pose, tuck your pelvis under, let the head drop, push the ground away from you, round that back as you draw your heart up towards the sky and draw the navel towards the spine. And now I'm going to have you just draw your hips down towards your heels, slowly and gently, actually taking inventory of all the parts of your spine. You're probably going to be experiencing a lot of tightness in the lower back if you're working out an injury recently. And an injury is just throwing your back out. That is an injury. So draw slowly those hips down to the heels. And once you get all the way down, lift your gaze so that you're gazing at your fingertips. And now, leading with your chest, draw yourself up into tabletop position again. Now let's go ahead and go into cat pose again. Push the ground away from you, tuck that pelvis, draw navel towards spine. And now slowly, 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 taking lovely inventory of all the areas of the back around the spine area. Slowly draw your hips towards your heels. Really getting a nice stretch in that lower back. Gaze towards your fingertips, flatten that back, and using your chest to lead, draw yourself up into tabletop position. And let's do it for a third time. Tuck that pelvis, push the ground away from you. Round that back, draw the back of the heart up towards the sky, and draw the navel towards the spine. Traction in the neck. Start to draw your hips towards your heels. Slow, 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 so that you can really find where you need that stretch in the lower back and give that to yourself. Once your hips have reached your heels, relax. Draw that back into turn that back into a flat back, and leading with your chest, back up into tabletop pose. Okay, so now I'm going to have you get into a standing position so that we can do some of the hamstring work that really helps keep your lower back nice and healthy. So tight hamstrings, tight hips, tight glutes, bad lower back. That's the bottom line. And remember, if you use that tennis ball to release those tight muscles in your glutes, and you do the psoas release, 1 inch over, 1 inch up, dig in on both sides, really find that muscle and give it some pressure so that you can create a release of the spasm. Remember, something I learned in yoga certification is muscles will not spontaneously unspasm. They have to be acted on by some outside force in order to unspasm. So, good thing to keep in mind. So let's go to a standing position, and I want you to take your time, get there as slowly and comfortably as you need to. I'm just going to go ahead and stand. You do what you need to do to get to a standing position. Okay, let's see. Hang with me. I'll get it. Okay. So I'm going to actually move this so you can see my feet better than you can see my head. So we're going to inhale and draw our hands up over our head. That's what I'm doing that you can't see. And then drop your hands down by your side, and then take your hands down the sides of your legs until you can touch your toes. Now, if touching your toes is not on the menu for today, maybe it's not on the menu for any day. Some people are just born with tight hamstrings or short hamstrings. Then you can use your block. And you can always remember that your block's got 3 positions, right? This is the highest position, this is the next highest position, and that's the lowest position, okay? So you can have your block in whichever position suits you so that you can have straight legs and be able to rest your hands on something that's comfortable. So what you're going to do now is you're going to take your right foot and cross it over your left foot so that your pinky toes are touching. And then you're going to let your left hip drop a little bit out to the side and draw your the right part of your chest, or rather draw your chest over to the right. And then drop your head. And what you're getting there is an awesome stretch right down the IT band. When the IT band isn't well, what's it called? I want to say vaccinated, but that's not right. When it doesn't have a lot of blood flow in it, it gets very tight. And when it does have a lot of blood flow, it's more flexible. It's not a muscle, I believe it's a tendon. So go ahead and hold this position with your left hip jutting out to the left and your chest moving over towards the right, and your feet crossed over, one in front of the other, and your pinky toes touching. And just as my old yoga instructor Susie Bear used to say, find the repose in your pose. Remember to drop that head, remember to breathe. And when you're ready, uncross your feet, take a moment to settle, and now recross with the left over right and the pinky toes touching. Both heels are on the ground. If you need to be up on your block like this, so be it. If you are comfortable here, great. If you're comfortable here, that's fine. And if you want to put your hands on the ground, that's fine too. So now you're going to let that right hip jut out to the right, and you're going to draw your chest over to the left, and then you're going to drop your head and breathe. Vacillation? No. Lots of blood flow going now into that IT band. Remember to soften the parts of your body that don't need to be engaged in this stretch. The exhale is a great opportunity to soften. When you're ready, uncross your feet and then just take a moment to unwind. Bend those knees, place your hands on your knees, gently push yourself up into a standing position, using your hands on your legs to push you up. For those of you who are experiencing acute back pain, you're probably not going to be doing this part of the practice, which is absolutely fine. I have one last practice I want to show you. This one we can put a little bit higher. Hello. So this is called a sacral reset pose, and it was invented by my yoga guru, Diane Roberts at Foundation Yoga. And it can be awkward to get to the place where you get it right, but once you've got it right, it feels amazing. So you want to have your feet nice and flat on the ground, hip distance apart, and you want to draw your tailbone down towards the ground. So you're not letting it scoop under, and you don't have an arch in your back. You don't have an arch in your back, and you're not scooping under. You're just drawing your tailbone down towards the ground. You draw your navel towards your spine, and you slightly tilt your rib cage. So here I am. This is kind of a comfortable stance for me. I don't know if you'll be able to see this through my sweatshirt, but when I tilt my rib cage up, it's not a matter of drawing my arms back in order to have a straight spine. It's a matter of just tilting my rib cage up a little bit, lifting my chin a little, and then just tucking my chin a little. When I'm in this position here, I can feel my spine is stacked properly, one vertebra on top of the other. So you're gonna have a block in your hand when you find this nice straight position, which is to say feet parallel, hip distance apart, tailbone drawing down towards the ground, navel towards the spine, rib cage tilted, chin lifted, and slightly tucked. All pretty subtle stuff. Take the block, put it between your legs, and then let it come up pretty high towards the top of the thighs. Now you're going to move your feet as close together as you comfortably can, and you're going to squeeze that block. Hold on for 2 seconds. I have to stand on the mat, or I'm going to slip around on my socks. Okay, so those feet are coming close together, and you're squeezing that block between your thighs. And now you're going to draw that tailbone down towards the ground, because actually squeezing the block can cause you to create an arch in your spine. So you want to take that arch out of your spine by drawing the tailbone down towards the ground. Now you're going to take your fingers and you're going to press it on the block. So you're pressing the block backwards, you're squeezing the block with your thighs, and you're drawing your tailbone down towards the ground. And as you push the block with your fingertips, draw those shoulder blades back. Draw the shoulders back and away from the ears, and let the shoulder blades slip ever so slightly down the back. So as you're pushing the block with your fingers, squeezing the block with your thighs, drawing that tailbone down to take an arch out of the lower back, and drawing those shoulders back and then shoulder blades down, you're now creating a position of perfect supported posture. And it feels delightful. You may be shaking because squeezing that block, it takes work. Pushing that block with your fingers takes work. But you want to hold that pose for as long as you comfortably can. Giving yourself lots of oxygen through your breath to swirl around in all the activated parts of your body. And then when you're ready, release and remove the block. And take a moment to just stand and feel. Your hips might feel a little bit more open. Your chest might feel a little bit more open. You might feel stronger, more stable.
and you may feel a lot of blood flow through the body.